Hi, this is Keith. This presentation goes along with Chapter 10, so if you haven't read that chapter yet, it's a good idea to do that first and then watch this presentation. In this presentation, we'll discuss sexual variations, with a focus on paraphilic behaviors, types of paraphilias, and the treatment of paraphilic disorders. The range of human sexual behavior is almost infinite. However, most of our activities and fantasies cluster within the general range of our predominant culture and social sexual norms. We talked a lot about these sexual behaviors in our last chapter and include sex with different and same-sex adult partners, hookups, penile vaginal intercourse, penile anal intercourse, and oral sex. So what do we mean when we say sexual variations? Sexual variations refer to those behaviors that are not statistically typical of American sexual behaviors. These are sexual behaviors that may occur in addition to the mainstream, quote unquote, expression of sexuality. While we may use the term sexual variation, there are other terms like atypical sexual behavior, kinky sex, or kink that are used to describe this type of behavior. Now, it's really important to understand that atypical behavior does not necessarily mean that the behavior is abnormal. For example, swinging is not practiced by most adults. However, it's not abnormal behavior. It's perfectly safe and practiced by well-adjusted adults. In contrast, there are some sexual variations that are considered so extreme that they are classified as mental disorders by the American Psychiatric Association. We'll talk about some of those in this chapter, but know that there continues to be a lot of debate about which sexual behavior should and should not be classified as abnormal and given a diagnostic code. So what do we mean by paraphilia? Paraphilia is an out-of-the-ordinary sexual behavior that does not necessarily need psychiatric treatment. The American Psychiatric Association in the Diagnostic and Statistical Manual of Mental Disorders, fifth edition, defines paraphilia as the following: is any intense and persistent sexual interest other than sexual interest in genital stimulation or preparatory fondling with phenotypically normal, physically mature, consenting human partners. So that's a lot to unpack. But it does make a distinction between paraphilias and paraphilic disorders, which are considered harmful sexual behaviors. And by harmful, we mean that the behavior must either cause high levels of distress to the person, or impair the person's functioning, or cause harms to others, or a combination of these. In addition, a paraphilic disorder is one that must occur over a period of at least 6 months. If a particular impulse does not induce distress or lead to any functional impairment, or there is no history of acting on the urge, then we call that a paraphilic sexual interest, but it is not necessarily classified as a disorder. Studies show that for people with a paraphilia, that paraphilic behavior is the predominant sexual behavior in their lives, although they may continue to participate in sexual activities that are more common. But the paraphilic behavior tends to be fairly insistent, obsessional, and compulsory. So having a fantasy about something that is considered a paraphilia once or twice during masturbation does not necessarily mean that somebody has a paraphilia. A critical dimension of a paraphilia is whether it involves coercion or not. Non-coercive paraphilias are regarded as being victimless because it involves either the person or it involves a consenting adult. We'll talk more about some of these later, but domination, submission, fetishism, and transvestism are examples of non-coercive paraphilias. That is in sharp contrast to coercive paraphilias, which are non-consensual sexual activities that cause harm to others, which includes exhibitionism, sexual sadism, zoophilia, pedophilia, and others. So here you see common and less common paraphilias. We'll discuss many of these in this chapter. So, as we just discussed, it's important to distinguish between coercive and non-coercive paraphilias. Non-coercive paraphilias include ones like fetishism and transvestism, as well as less common paraphilias like urophilia. In contrast, coercive paraphilias that are non-consensual sex acts include paraphilias like exhibitionism, pedophilia, and zoophilia. So take a moment and read through some of these different paraphilias to get a sense of them. Importantly, some seemingly related terms sound scientific but are really moral judgments. So let's take a look at some of these. For example, nymphomania is a pejorative term referring to abnormal or excessive sexual desires in women. This term was coined and used widely in the 19th century by people like Krafft Ebing, who we learned about in chapter 2. And these were in response to cultural beliefs that pathologized women's sexual desire. What's commonly known is satyriasis, which is abnormal or uncontrollable sexual desire in men. This term may be less known and used because we expect, as a society, men to be more interested in sex and engage in it more often than women. A more accepted term is hypersexuality, which refers to a very high level of desire or frequency of sexual activity. So in recent years, hypersexuality is commonly called sexual addiction. Okay, so what do we know about the frequency of paraphilic behaviors? First, paraphilic behaviors occur more often in males and are found in all ethnic and socioeconomic groups and among all sexual orientations and identities. It appears that overall rates of paraphilic experiences have increased steadily in recent years, and this may in part be due to the widespread use of the internet and ubiquitous depictions in popular media. A large-scale study conducted in Canada in 2017 provides the most comprehensive understanding of the frequency of paraphilias in the general population. The study was conducted by Joyal and Carpentier, and they found that paraphilia behaviors occur more often in males. The study showed that more men than women have experienced a paraphilic behavior at least once in their lifetime, and that more men expresses a desire to experience a paraphilic behavior. All right, so on this slide, you see the percentage of men and women reporting at least one lifetime episode of a paraphilic behavior from the study by Joyal and Carpentier. And note that each question began with this sort of beginning. Have you ever been sexually aroused by, and then gave the definition of that paraphilia. For example, have you ever been sexually aroused while watching a stranger who was unaware of your presence while they were nude or undressing or were having sexual relations? So this would be kind of measuring, have they ever been aroused by voyeurism? And it's really important to note that the questions do not assess if the behavior caused distress or impairment to the individual or occurred over a period of at least 6 months. So these criteria would be important to classify it as a disorder according to DSM-5. So just keep that in mind. These are not measuring disorders. So again, you can take a look at the rates of sexual arousal from these different types of paraphilias by whether somebody identifies as a man or a woman. You can see that voyeurism is quite high, especially among men, as well as fetishism, exhibitionism, and frauderism. And so those are quite high amongst all groups, but especially among men. And interestingly, masochism is the one case where a higher percentage of women reported being aroused by that than men. So that was sort of a standout among this group. All right, so in the last slide, you saw the percentage of people who reported actually being sexually aroused by by that paraphilia at least once in their lifetime. And in this slide, you see the percentage of men and women reporting desire or wish to experience a paraphilic behavior. So, for example, for exhibitionism, the question was asked, would you like to engage in sex acts knowing that someone is watching you or could be watching you? And again, what you'll kind of notice here is that more men than women tend to report wanting to engage in a paraphilic behavior, and especially common ones were voyeurism, fetishism, exhibitionism, and frauderism. But you notice also, interestingly, that a higher percentage of women reported wanting to engage in fetishism as well as masochism, more so than men. Okay, so we've been talking about paraphilia sort of in general, but let's start to get into sort of specific paraphilias. And the first is fetishism. Fetishism refers to the sexual attraction to objects that become, for the person with the fetish, sexual symbols. The fetish may be required or strongly preferred for sexual arousal because of the way the object looks, tastes, smells, and feels. However, studies generally show that the fetish object does not have to be present to get aroused by or enjoy sexual activity. Rather, it is an erotic preference. A fetish may be an inanimate object, or it may be a highly specific focus on a particular body part. An exclusive attraction to a body part or parts is called partialism. Now, it's important to note that most people have slightly fetishistic traits, right? Are you a chest or a leg person, or a butt person, or a breast person? So, for these and other reasons, there's a lot of debate about whether fetishism should be considered disorder at all. All right, the next one we'll talk about is transvesticism. This refers to the wearing of clothes of the other sex for sexual arousal. Now, for some, this may mean wearing just one article of clothing of the other sex in private. For other people, they may wear an entire outfit in public. About 7% of men and 4% of women report transvesticism behavior at least once in their lifetime. Now, it's important to note that this is different from transgenderism, which, as we learned before, is when someone's sex assigned at birth is different than their gender identity. So it's really important to keep those two concepts very distinct. Many individuals prefer to be labeled cross-dressers rather than the more clinical term transvestite, which tends to be sort of pathologizing. Cross-dressing can be an entertainment job, which may or may not be accompanied by sexual arousal. So we should be careful not to assume female impersonators, male impersonators, or drag queens are necessarily engaging in transvestism behaviors. So, and for the record, female impersonators are men who dress as women, male impersonators are women who dress as men, and drag queens are gay men who cross-dress to entertain. Now, the APA's DSM-5 has replaced transvestic fetishism with transvestic disorder as a way of acknowledging that cross-dressing itself is not inherently problematic. By transvestic disorder, DSM-5 defines it as a recurrent and intense cross-dressing or thoughts of doing so over at least 6 months, a period of 6 months, and it's accompanied by significant emotional distress. And that's really key. It's accompanied by significant emotional distress. Transvestic disorder is nearly exclusively reported in males, most of whom identify as heterosexual. It's important to also know that most men with transvestism are usually quite conventional in their usual attire and in their attitudes, and do not wish to live full time as the other gender or undergo sex confirmation surgery. Okay, the next paraphilia is zoophilia, and this refers to deriving sexual pleasure from animals. This is sometimes referred to as bestiality. Sometimes people may try to make a distinction between having sexual contact with animals because there are no other outlets for sex and what is referred to as, quote, true zoophilia, unquote, which is when animals are the preferred sexual contact. So zoophilia is considered a coercive paraphilia as the animal is not a willing participant. And studies show that very few people who have sex with animals consider it a substitute for human sex, and that half of persons who engage in this were in a committed relationship with a partner. While clearly coercive, most who sort of self-identify as zoophiles indicate a concern for the welfare of the animal and make a distinction between themselves and who they call bestialists, who are people who have sex with animals but are not concerned with the animal's welfare. Next up is voyeurism. These are the most frequently occurring of the potentially law-breaking sexual behaviors. But keep in mind that it is not considered voyeurism when the person being observed is willing and the activity does not replace interpersonal sexuality. So watching yourself or your partner having sex or recording a sex video is not considered voyeurism. With this in mind, voyeurism is the observing of an unsuspecting person who is naked, disrobing, or having sex. This is a very common paraphilic behavior, with 50% of men and 21% of women reporting at least one lifetime voyeurism behavior. Voyeuristic disorder involves recurrent, intense sexual urges and fantasies and causes significant personal distress and must occur over at least 6 month period, a 6 month period. So in addition, the voyeur must be at least 18 years of age. Why might this be the case? Well, it's because if we don't set an age limit, it would not be possible to differentiate voyeurism from age-appropriate sexual curiosity. In sum, the person who is the voyeur must be hiding and remains unseen while the person being watched is unaware of the voyeur. Now, in some ways, the flip side of voyeurism is exhibitionism, or the revealing of one's genitals to an unsuspecting person. This person is sometimes called a flasher and engages in indecent exposure. About 8% of men and 3% of women said that they have engaged in exhibitionistic behavior in their lifetime. In the United States, exhibitionism is more often considered a problem and legally punishable when it is committed by a man showing his genitals to a woman. Exhibitionism disorder is similar to the other paraphilias in that it requires experiencing significant personal distress or social impairment for at least 6 months. And but it's different that in it is different that in it also is considered disorder if the exhibitionist exposes his or her genitals to a non-consenting person, since that person is rightfully considered a victim. So again, this is a non-consensual paraphilia. Genital exposure by a man is not an invitation to intercourse. Rather, it's an escape from intercourse. Exhibitionists may not get aroused by exposing their genitals to a willing person, so the goal of this behavior is not to actually initiate sexual contact with the victim. Rather, it is often for the shock value of it, which is what the exhibitionist may find arousing. So, a similarly coercive paraphilia is telephone scatologia, or the making of obscene phone calls to unsuspecting people. Telephone scatologia is considered a paraphilia because the behaviors are compulsive or repetitive, or because the associated fantasies cause distress both for the person and for the victim. The arousal by making the obscene phone call typically occurs in response to the victim's shock reaction. And while the overwhelming majority of callers are male, some are female. Studies show that female victims of calls feel violated and are shocked by the call, whereas male victims have sometimes different responses and may not see them as violating. Now, in an event you receive a harassing or obscene phone call, the best thing to do is to not overreact and quietly hang up. The caller wants the audience, and the best thing to do is not engage. If the calls continue, then calling the authorities is appropriate. All right, next is frauderism, which is defined by the sexual gratification from sexual pressing, rubbing, or touching against a non-consenting person in a public location. Think of the creepy guy who stands way too close on the bus or the subway. It's also referred to as mashing, groping, or frottage. 32% of men and 21% of women report experience of frauderism behavior at least once in their lifetime, with nearly that many saying that they desire one. As with other disorders, frauderistic disorder is defined as significant personal distress or social impairment for at least 6 months. So you're starting to see the pattern of how we define a disorder. Frauderism often occurs with other paraphilias, including exhibitionism and voyeurism. One paraphilia that very little is known about is necrophilia. This is sexual activity with a corpse. It is considered non-consensual for obvious reasons. There are relatively few documented instances, but it remains a fascination in horror literature and Gothic novels. It also is associated with ritual cannibalism in some historic cases. The most common motive appears to be the possession of a partner who neither resists nor rejects. The final paraphilia, and the one which gets the most attention, is pedophilia, which is sexual interests are focused on prepubescent children. While this may seem counterintuitive, we need to draw a distinction between pedophilic disorder and related activities like child sexual abuse, child molestation, and incest. While child sexual abuse, molestation, and incest are illegal in most cases, a person who commits these may not actually meet APA's DSM-5 criteria for paraphilic disorder. In other words, sexual contact with a minor is not in itself a determination of pedophilic disorder. It must include distress and/or interpersonal impairment for at least 6 months. In this way, a person may have a pedophilia sexual orientation, but not pedophilic disorder. We also need to differentiate pedophilic disorder from normal childhood and adolescent sexual development. For someone to be diagnosed with pedophilic disorder, their sexual interests must include children of 13 years of age or younger, and the person with pedophilic disorder must be at least 16 and at least 5 years older than the child. Almost all people with pedophilic disorder are males, and girls are about twice as likely to be the sexual objects. Pedophilic behaviors are very uncommon, with less than 1% of male and females reporting sex with a child at least once in their lifetime. All right, a topic that has drawn more public interest since popular depictions in the media is BDSM. This stands for bondage, discipline, sadism, and masochism. BDSM is a widespread form of sexual variation in which sexual gratification is derived from being dominated, dominating another person, giving pain referred to as sadism or receiving pain referred to as masochism. About 14% of men and 28% of women report participating in masochism at least once in their lifetime, and about 7% of men and 4% of women report participating in sadism at least once in their lifetime. Now, the APA does not list domination and submission as a paraphilic disorder because they are considered consensual. However, sexual sadism and sexual masochism can cause significant distress and involve a non-consenting partner. So these are listed as paraphilic disorders. In any case, persons who practice BDSM are no more likely than others to have psychological disorders, and it is not linked to childhood sexual abuse. Rather than being disordered, domination and submission are forms of fantasy sex, often with behaviors carefully controlled by elaborate scripts. So the critical element is power, not pain. Domination and submission can take many forms. In its most common form, bondage and discipline, or B&D, is where a person is bound while another stimulates or engages in discipline activities. Again, sort of think of popular depictions like in 50 Shades of Grey. Studies show that about 11% of men and women have experience with bondage. Now, there are persons who specialize in this and other types of disciplining activities, and these are called such a person is called the dominatrix. Domination and submission clubs are also common and are sometimes known as quote unquote the velvet underground. These forms of domination and submission should be differentiated from sexual sadism and masochism. Sexual sadism disorder is recurring intense sexual urges or fantasies involving real harm to a victim for a purpose of intense sexual arousal and lasting for at least 6 months. The complement to that is sexual masochism disorder, which is intense, recurring sexual urges or fantasies involving real behaviors of being humiliated, beaten, bound, or otherwise made to suffer, and this, of course, as all other paraphilic disorders, lasting for at least 6 months. Finally, a form of sexual masochism is autoerotic asphyxia. This is strangulation while masturbating. Essentially, the person may seek to heighten their masturbatory arousal and orgasm by cutting off oxygen supply to the brain. It can either be done alone or with another person. Now, this kind of behavior is actually quite dangerous, with more than 1,000 deaths occurring in the US due to this. Okay, so research on the causes and origins of paraphilias has been limited and difficult to conduct. The cause is probably the result from some type of interaction among biology, sociocultural norms, and life experiences. Some studies show that some people with paraphilia may have grown up in dysfunctional environments and have experiences that limit their ability to be sexually stimulated by consensual sexual activities. But again, that's certainly not everyone. And in non-consensual paraphilias, perpetrators may have a limited capacity for empathy. Therapists have found paraphilias to be difficult to treat. Some multifaceted treatments have attempted to reduce or eliminate symptoms. A number of different approaches to treat paraphilias have been taken, and these include psychodynamic therapy, aversive conditioning, cognitive behavioral programs, relapse prevention, and medical interventions, such as modifying hormone levels. Some approaches do seem to have some impact, particularly those that enhance social and sexual skills, develop self-management plans, modify sexual interests, and provide sexuality and relationship education. However, unfortunately, relapses often occur. And that is the end of this lecture.